Our founder, Conrad N. Hilton, made it very clear that young children were to be an important part of our funding. He noted that just as children must bear the burdens of our mistakes, so too are they in their innocence, the repositories of our hopes for the upward progress of humanity. One way we honor our donors' intent to support children is through our Young Children Affected by HIV and AIDS initiative, which focuses on the importance of early childhood in the first 1,000 days of life for young children in 5 countries in Africa affected by higher rates of HIV and AIDS. When I was a young field office director for Save the Children in West Africa in the early 1990s, we spent a lot of time on child survival and children's physical health. We would go into villages and help the leaders and the parents in the village establish a health committee so they would know which children needed vaccinations. In villages that had no other writing, we would paint numbers on the walls of huts so people would know which children needed which vaccinations. And we had real results from it. We reduced child mortality rates drastically, and more children lived to see their 2nd, their 3rd, their 5th birthdays. But we also had to admit over time that we had spent a lot of time on children's physical health, and there was much more to children that needed attention. But our efforts have been laser focused on a few key health efforts, and we realized that we needed to broaden our approach. Now, in an era where more than 90% of children survive to their 5th birthday, we need to pay more attention to how they thrive, how they grow up to be healthy, well-educated, and productive adults. We've long known that investment in early childhood is very important. Economic data in the United States show there's a return of $17 for every dollar invested, much higher than for college education. There's scientific evidence as well that the brain develops most robustly in the first 3 years of life. And yet, ECD, early childhood development, has always been an unfunded priority. If we look at the Sustainable Development Goals, kind of the world's homework for the next 15 years, we see goals on ending malnutrition for children. We see a goal on early education. World Bank President Jim Kim has made the reduction of stunting, that is low height for age, one of the 4 priorities of the World Bank, along with climate change, migration, and pandemics. He views it as that important. He feels that if we can reduce stunting, we can increase the economic development of entire nations. Given the importance of ECD to our work and the importance of healthy young children, you can imagine how excited we were last May when the World Health Organization adopted the Nurturing Care Framework for early childhood development. This framework gives guidance to medical professionals to look at care for child development broadly. We know from extensive research that children's brains may not develop fully if they don't receive nurturing care. Recognizing that 80% of a child's brain is developed before the age of 3 years, the framework seeks to help all of us improve the way we raise infants and toddlers. At the Hilton Foundation, we find all this momentum to be very promising, and we pledge to do our part to move early childhood toward being a funded priority and a well-executed movement that benefits millions of children, and in Conrad Hilton's words, that makes a contribution to the upward progress of humanity. Thank you.